It's Mari McInerney from Croaky here at the VIMIAC conference. That's the Victorian Mental Illness Awareness Council, and we're here in Melbourne with Elvis, who is the first keynote speaker here at the Youth Day. Elvis, could you introduce yourself, please?
Hi, my name is Elvis Martin. I'm the Principal Ambassador for National Youth Commission and National Deputy Chair for Red Cross, and that's all.
Fantastic. Now, you had some main calls to action that you wanted to get across to the participants here today.
Yeah, I gave like 4 call to actions. It's really important for lived experience people to raise their voice and participate and try to. And it's also important for organization and leaders to bring lived experience voice to the table while making decisions and reforms. So the first call to action was like to raise your voice and be an advocate. Second one was to reduce stigma, and that call to action was like to share a bit about their mental health journey online on social media platforms and use hashtag not ashamed and hashtag it's time to change. And especially I encourage people who are in leadership roles, in organization leadership roles, or politicians, or anyone who can, like, because they are influential people, and when they talk about their journey, that actually inspires other people to speak up. And uh, and and I think, as I mentioned, that I wish to live in a world where being vulnerable is not seen as being incapable.
You're one of those people who are sharing your story and doing that powerful advocacy. Can you talk about your background and what work you do?
I advocate for young people who go through mental health, homelessness, domestic violence, suicide prevention, and this sort of like trying to advocate for social justice.
And that's from a perspective of lived experience.
Yes, and half of yes.
Yeah. Now, one of the interesting points you made was that stigma is still a big issue across the board, but it's also something experienced very hard by particular communities. Could you
Yes.
talk to that?
Yeah, so I mentioned about, like, especially mental health stigma in CLAD community, which is a culturally diverse community, and LGBTI community is a big issue. People don't talk about their mental health because their communities doesn't accept that. The second they talk about mental health, opportunities get denied. They don't get equal access to the things they deserve, or we all human need. And so that's why it's very hard for them to speak up. And it goes same with LGBTI community. They don't get proper services, they don't get proper support, and system is broken. System have big gaps that need to be filled, and without lived experience voices, I don't think that can be filled. And I talked about international student, because I experienced firsthand. I took a young person to a hospital, and I have seen him. Hospitals say they can't take it because he's an international student and he was suicidal. So it's just hard.
That was a terrible example you gave, where you said that he either had to pay a lot of money,
$575,
or be arrested.
Yes. So eventually they have taken him in once he get arrested. So making criminal records for people, and for what? Just to access health, basic needs, and basic human rights, and it's just disgusting.
So, talking about the peer workforce, you had a very strong call to action for organisations working in mental health and probably across the board in social services. To not what?
So I think a lot of organization organize consumer voice, but some of them take it in a way, organize in a very tokenistic way to tick their boxes and to win tenders and grants. And what I believe is lived experience people, and how lived experience people get treated is like, in some organization, or most organization, you can say, as a cheap labor.
In what way? Can you give an example of that?
So I gave one example of a person who I met 2 days ago, and he told me he's volunteering from 4 or 5 years, and the organization supports him. And when he told me the supports they provide is sometimes they put money in his marquee, that is not paying for the person's time. And lived experience people have their expertise, and they should be reimbursed as experts, not as a cheap labor. And I'm against it, and I just hate it.
You've talked a lot today about what young people particularly can do and people with lived experience can do, but we've got coming up a lot of findings from big investigations into mental health,
Mental Health
including the
Commission.
Royal Commission here.
Yeah.
What are you hoping it does, and what are your concerns?
A lot, actually, a lot. First, uh, bringing the lived experience voice to the table, and that's the most important thing. And I think that's all we all are here today for WMIAC conference. And at the same time, what I want young people to do is that reach out to your politicians, reach out to your local members, reach out to decision makers, and maybe make submissions in commission in inquiries, and try to raise your voice. You can do it. You don't need to have PhDs or masters to be an advocate. Your lived experience is enough.
What gave you the strength to be able to talk out?
Uh, I did experience a bit of tough time, and I think that actually motivated me to do what I'm doing today.
Fantastic. Anything else you'd like to say, Albert?
I just want to say, young people with lived experience and young people who are struggling there, you are not alone. We all are here for you. Reach out. Don't be ashamed of your mental health journey, because mental health is nothing to be ashamed of. There is nothing wrong with you, but there is a lot wrong with the world that you live in. Thank you.
Thank you very